The Spanish flu pandemic, also known as the 1918 flu pandemic, was one of the deadliest pandemics in human history. It occurred between 1918 and 1920 during the final stages of World War I and is estimated to have infected 1/3 of the world's population, resulting in the deaths of 50 to 100 million people. The Spanish flu was caused by the H1N1 influenza virus, and it spread rapidly around the world, affecting all continents. The origins of the pandemic are still unclear, but there are various hypotheses suggesting that it may have originated in China, the United States, or France. The virus was highly contagious, and the rapid movement of troops during World War I facilitated its spread. The symptoms of the Spanish flu were severe and included fever, cough, and body aches. In some cases, the virus caused pneumonia and other complications that resulted in death. The pandemic had a significant impact on the world, causing widespread social and economic disruptions, including labor shortages, school and business closures, and decreased trade and travel. Governments and health organizations struggled to contain the pandemic, with many cities implementing quarantine measures and closing public spaces. The lack of effective treatments or vaccines at the time made it difficult to control the spread of the virus. However, efforts to mitigate the impact of the pandemic did lead to significant advances in public health practices, including the development of modern disease surveillance and control systems. The Spanish flu pandemic affected people from all walks of life, with many famous individuals, including soldiers, politicians, and artists, among its victims. The pandemic also highlighted the disparities in health outcomes between different populations, with indigenous communities and people living in poverty particularly hard hit. The Spanish flu pandemic was a significant event in world history, with far-reaching social, economic, and political consequences. Its legacy can still be felt today, serving as a reminder of the importance of public health measures and the need for effective disease control strategies in the face of global health threats.